Okay, next we'll see the what pharmacokinetics of the warfarin. Okay, pharmacokinetics of the warfarin. Warfarin is in the form of two forms, that is nothing but S form and R form. Okay, S form is nothing but the levorotatory form, and it's comes to the R form, it's nothing but dextrorotatory form. Okay, so comes to is levorotatory enantiomer and dextrorotatory enantiomer. This S form is metabolized by the CYP2A6 and comes to the R form is metabolized by the CYP1A and CYP3A4. Okay, and also it is metabolized by the using of the ring oxidation method, and it is metabolized by using of the side chain reduction method. Okay, so this is the pharmacokinetics of the warfarin. Okay, S form and R form. Okay, so these are the things which comes under the pharmacokinetics. S form is a levorotatory enantiomer, and R form is the dextrorotatory enantiomer, which is metabolized by the CYP2A6, and here it is metabolized by the CYP1A and CYP3A4. Okay, so and also it is metabolized by the using of the method, that is the ring oxidation, and it is here this method is the side chain reductase method. Okay, so when it comes to basically it's taken in the enterohepatic circulation, and which is in turn excreted through the kidney. Okay, that is the main thing which is happening, which is taken place by the warfarin. And comes to the dose, so always the dose regulations are very mandatory for this warfarin. Why? Because warfarin is giving the patients in order to regulate the coagulation. Okay, in order to reduce or prevent the coagulation, so that when warfarin is given to the patient, always you have to calculate the prothrombin time, and always you have to go for the international normalized ratio, that is nothing but INR ratio. Based on this only we have to administer the warfarin to the patient. Okay, that means specific values by using the specific conditions. Okay, for specific conditions, specific values for the specific condition. Okay, suppose if the treatment for the deep vein thrombosis, suppose if you are administering this warfarin for the deep vein thrombosis patients, okay, that INR ratio must be 2 to 3. Okay, so then only warfarin must be administered to the patient. So that what you have to understand here, warfarin is the very critical, and it is a specialized drug to be given to the patient by calculating the INR ratio, and as well by calculating the prothrombin time. Okay, specific values to be given for the specific disease conditions. Okay, suppose if we don't maintain all these particular events, so what will happen? Warfarin can cause the severe bleeding for the patients. Okay, so in order to prevent the severe bleeding, the note, okay, I have given the specific note here. If we don't follow these rules and regulations while administering the warfarin can cause the bleeding. Okay, so INR values are used to achieve a therapeutic effect without increasing the risk of bleeding. Understood? This international normalized ratio levels has to be used to achieve the therapeutic effect without increasing the risk of the bleeding. Okay, that is the main thing why we are calculating the INR levels as well prothrombin timings. Okay, so that is about the dose regulations. Next comes to the adverse effects. Okay, when it comes to the adverse effects, ecchymosis and epistaxis. Okay, if the drug of choice is toxis, okay, what will happen? Ecchymosis, if we don't follow all those things, that leads to the adverse effects of the ecchymosis, epistaxis, hematuria, GI is bleeding, and fetal intracranial bleeds, and other adverse effects which includes alopecia, dermatitis, and diarrhea. Okay, so next comes to the contraindications. So what are the contraindications of the warfarin? Warfarin should not be administered with the bleeding disorders patient and severe hypertension, pregnancy patient, and comes to the chronic alcoholic patients. Okay, so these are the things which have to be followed while we are administering the warfarin to the patient. So later you can write the drug interaction as well nurse's responsibility of the warfarin. Okay, this is about the oral anticoagulant, that specifically we taught about the warfarin. Okay, apart from the heparin and all, it's given as a parenteral route, but warfarin is a compulsory, is a oral anticoagulant. Okay, I hope everybody have understood. If you don't understand, you please let me know so that I will repeat it again. Thank you one and all.